what you were going to be seeing tonight are many happy mothers, happy babies, cared for by midwives, photographs taken to celebrate the centenary of the Royal College of Midwives. That's an ideal situation. The reality, however, for many women and young girls in the developing world, and certainly in sub-Saharan Africa, is that they give birth alone. In Ethiopia, where SafeHands is currently focused, only 6% of all women give birth at home. And what you were going to see at the end of this was a story about Talanish. Talanish was betrothed at 3, married at 10, and gave birth at 12. After a very obstructed labor of 6 days, her baby died after 2 hours, and she was left with an obstetric fistula, which is a hole between the bladder and the vagina, leaving her permanently incontinent and marginalized from society. I'm terribly sorry you're not going to be able to see that. But until we raise the age of marriage, in this case, a young girl being married at 10 and her husband 14, and have access to emergency obstetric care, and ensure skilled birth attendance at birth, young girls like Talanish, age 14, will continue to suffer from the devastating consequences of fistula. 1 woman dies every minute somewhere in the world. You've been here tonight for an hour. 60 women have died somewhere in the world simply because they were pregnant. That is a tragedy, and a tragedy which is largely preventable. But these women aren't statistics. These women could be your mothers, your sisters, your daughters, your aunties. And those women all have names. The work of SafeHands for Mothers is to help in the reduction of maternal mortality and morbidity, and to protect the health of the newborn. And we do this by providing very high quality films. Films that educate, films that train, and films that advocate for change. Now, people often say to me, how can you produce these films when the areas you're working in have no electricity? We are working with solar-powered DVD players, and I would encourage you all to look at one of the portable players that we have on the table afterwards. This is a health extension worker who walks 3 hours a day to get to her location, and 3 hours back again. But the portability of the solar-powered DVD player means that when she gets to her location, she can disseminate a message, and that message gets across to women, especially women and children, who otherwise have never been educated. We also introduced a solar-powered box, more robust. These are health extension frontline health workers in Ethiopia. 3 clicks of a button and bingo, your message is there. And that same young woman, tonight, feels very empowered when she goes back to her community of Wando Gannett, because that community can then look at the film called The Big Push, Making Pregnancy Safer Ethiopia. That film has now been accepted by the Ministry of Health as a resource tool in the educating of their frontline health workers. Or in the case of a health post, when the communities come to the health post for their vaccinations, family planning, there is time for them to be able to watch video. And of course we know that if we educate a girl child, she is going to be able to know the legal age of marriage and understand about family planning, and hopefully grow up to be that winner in society and a powerful woman within her community. And when she is ready to bear children, she will have understood the advantage of being able to go to a health clinic or a health center where they have skilled birth attendants. But never forget what it would be like to walk a mile in her shoes. Thank you.